Social Health Insurance Fund is designed to improve universal...
Order, Honorable Lillian Gogo, would you first move just to the extent possible? I know the motion is in terms of what was approved. You don't have to read the whole of it, but if you can pick so that you move.
Yeah, just doing a component. I was just about to finish. Thank you, Honorable Speaker. The objectives are commendable as it aims to bridge critical gaps, though the rollout has faced several challenges, and it is important that we look at this as a matter of national importance. I beg to move, Honorable Speaker.
Yes, so proceed. Proceed, you had moved.
Oh, thank you so much. Honorable Speaker, there is the
maybe I clarify to the honorable members from the beginning. The Honorable Dr. Lillian Gogo, you have 10 minutes.
Oh, okay.
All other members have not more than 5 minutes under the standing orders. So proceed.
Thank you very much. Honorable Speaker, it is usually the desire of every government to provide health care to its citizenry. And as it were, Honorable Speaker, there was need to change from what was old and of old generation, the National Hospital Insurance Fund, to what was presumed to be a better quality healthcare system, the Social Health Insurance Fund, Shif, that is to be managed by the Social Health Authority. One, there are so many aspects that are brought, Honorable Speaker, and citizens are confused. They don't know whether it is NIF, they don't know whether it is Shif, they don't know whether it is SHA, they don't know whether it is SHO. People need to be appraised. Shisha, no, not Shisha. People need to be appraised on this matter. It affects their health. Honorable Speaker, in my last salary, 32,000 and some other shillings were deducted from my salary. One, this caused delay, but it eventually went. And I'm told that those who are not able can pay as low as 500 shillings and still get health care. But the challenge that I have, Honorable Speaker, that is making me raise this matter is these monies, do they go to the ground, Honorable Speaker? Do they go to the intended persons, Honorable Speaker? Honorable Speaker, how much has this particular program allocated for the purchasing of equipment, Honorable Speaker? How much, Honorable Speaker, has this program put aside, this health insurance, how much has it put aside for the training of healthcare workers, Honorable Speaker? We have seen our highly trained doctors and nurses. We have seen our highly trained doctors and nurses being encouraged to go and look for jobs abroad. As much as money is gotten from my salary, the concern that I have, Honorable Speaker, is that does this money reach a poor woman who is going to deliver at the Rangwe Sub-County Hospital? That is my concern, Honorable Speaker. Another concern that I have, Honorable Speaker, is that there should have been a smooth transition. There should have been a 6-month transition. People should have been sensitized. But because of issues of trust, the citizens, Honorable Speaker, are refusing even to register in this social health insurance fund. They are refusing. It has not been explained well to them why they need to pay for it. And the money is delayed, Honorable Speaker. When you go to the hospital, you are told that you have not been transferred to Shif. I get messages on my phone saying that I've been successfully transferred to Shif. Now, am I successfully transferred to Shif because probably I'm a member of parliament, or do the other normal citizenry, Honorable Speaker, do they get the same messages? And if we are able to do that, why not do it for everybody? Why not do it so that people don't go to our hospitals and they are turned away, Honorable Speaker? And the persons who suffer most, Honorable Speaker, are the women. The persons who suffer most, Honorable Speaker, are the caregivers. More often than not, caregivers are women. And they have to take care of children. They have to take care of the vulnerable, people with disabilities. They have to take care, Honorable Speaker, of the elderly. And you go to hospital, you're turned away. If we don't look at this matter critically, Honorable Speaker, if we don't sit as a community, if we don't sit as lawmakers, if the executive does not think, rethink, change of policy, and the gaps that it creates, and how these gaps can be covered, the person that suffers, Honorable Speaker, is the grass. And the grass is the mother of Akinyi and Adhiambo. Honorable Speaker, allow me to say this. I think we are taking Kenyans for granted, Honorable Speaker. Honorable Speaker, I think we are also creating unnecessary positions to benefit those who are elite in our community. We have the Social Health Authority. If up to now, as I'm speaking, the rollout was 1st of October, and we are almost advancing into November, what is this authority doing to make sure that as many as possible are registered? I went into a registration camp, Honorable Speaker, in one of the counties. As people were registering, there were clerks. And as they were being registered, if you say, Honorable Speaker, there were two options among the places that were to be filled. Do you live in a rental house? Do you live in your own house? Or do you pay rent? That is the question that you are asked. The most obvious thing is that you would say you pay rent when you are paying rent. And they use some of these questions to corner the citizens. They hide these questions to corner the citizens, Honorable Speaker. When you say that you are paying rent, then it means that you are salaried, and they go for your salary. You're staying in your own house, then they put you in a category of people who are paying less. Why can't we have a foolproof system, Honorable Speaker? Why don't we have a system that moves smoothly, Honorable Speaker? Honorable Speaker, it is my concern. It is my concern that we are failing most sectors of our economy. But the one is healthcare. All of us today are seated here, Honorable Speaker, because for one reason or another, or by grace of God, we are well. But if you go to our hospitals, Honorable Speaker, people are writhing in pain, absolute pain. And with the increment of cases of cancer, Honorable Speaker, I'm so shocked that right now, the middle age are getting cancer even the more, Honorable Speaker. How are we going to take care of our young people, especially if we have a healthcare system that cannot be rolled out smoothly? Besides that, Honorable Speaker, we have a healthcare system that cannot make money reach where it is intended to reach. Private hospitals provide a substantial amount of assistance. Only 1 second.
30 seconds to conclude.
I thank you. Thank you for the 30 seconds. Private hospitals provide healthcare, Honorable Speaker. These are people you can never negotiate with. But when our people go, they are turned away. When they go to public hospitals, they are turned away. Where will the Kenyan poor, Honorable Speaker, go to? As a member of parliament, I go to the constituency. I am told by my teaching community, I am told by the elite of the community, please talk about she, sha, show. I thank you.
The chair of the departmental committee in charge of health, the Honorable Dr. Pukose.
Thank you, Honorable Speaker, for giving me to contribute to the issues which have been raised by Honorable Lilian Koko. First and foremost, I think it is good that we understand what we are talking about. The authority is called Social Health Authority. And this authority, that is the SHA. This authority was a creation of this House. It runs 3 funds: the Social Health Insurance Fund, the Emergency, Chronic and Critical Care Fund, and the Primary Health Care Fund. All the 3 funds now replaced the one fund which we had, the NHIF. NHIF had a lot of many problems and challenges. And the previous governments have tried to see how best we can be able to introduce the universal health care. We had pilot projects in Nyeri, Machakos, Kisumu, and other areas to see how we can be able to introduce this. When President Ruto came into government, he brought bills to be able to operationalize how can we be able to achieve universal health care as one of his projects, as one of his agendas in the manifesto of UDA and Kenya Kwanza. In this, we passed the Digital Health Authority, Digital Health Bill. We passed the Social Health Insurance, the Social Health Authority Bill, and we also passed the Primary Health Care Bill and also the Facility Improvement Fund. Honorable members, on 1st October, the government began rolling out this program on providing of Kenyans universal health care. It is 5 weeks now. In this program, as we speak today, we have several successes that we've seen. Among them, we have 39,000 Kenyans who have attended renal care visits. We have 81,000 Kenyans who have had admissions. 12,000 cancer care visits. We've had 49,000 consultations at the primary care. And what is the impact on this? That we've had renal and hemato-oncology, 430 million approved for life-saving dialysis care over the past 5 weeks. We've had more than 300 million approved for cancer care. The average turnaround time for pre-authorization has now improved. Initially, we had challenges, but as we speak today, it is at the turnaround time is 2 hours. We've had challenges in terms of private hospitals, in terms of accepting and running this program. But in the 4 major hospitals, referral hospitals, that's the Moi Teaching and Referral Hospital, Kenyatta National Hospital, Kenyatta University Teaching and Referral Hospital, Mathare Hospital, spinal injury, all these hospitals, as we speak today, there is no single patient who has gone there and been turned away. NHIF had a lot of challenges. In it, we had close to 12 million as beneficiaries of NHIF. Out of that 12 million, when the system was connected to the National Registration Bureau, 9 million Kenyans were found to be able to be transferred from the NHIF system to the SHA system. And that is where you got messages telling you that you are now transferred to the Social Health Authority. You can access Social Health Insurance Fund, which you contribute about 2.75, while the Primary Health Care Fund is fully funded by the government to a tune of 4 billion. The Emergency, Chronic and Critical Care is funded to about 2 billion. That is, you might ask yourself, this might be a very small amount compared to many Kenyans. But not everybody is sick. The biggest challenge today that we face is that many people want to register when you become sick. And when the Social Health Authority, together with the CS, appeared before our committee, one of the commitments which we've asked them to do is that in every constituency office, they are going to release a letter so that at every constituency office, you can now register people so that it is possible for you not to register at the time of seeking treatment, but to register in advance so that when you just go to the hospital, you're already a registered member. If I can ask for just one more minute, Mr. Speaker. So this is important, honorable members, because you have indigents. You have people who cannot be able to pay, and these are the people who expect the government to pay for them. Therefore, by registering within your constituency or within the women reps or even the senators' offices, we can use the means testing to identify.
1 minute because of the information is giving being committee chair.
We have the Social Health Authority, together with the Digital Health Agency, will send their staff so that they can liaise with your constituency office managers and your team so that your constituents can be registered, and through means testing, we can be able to pick those who are indigents and they can be able to access services so that the government can pay for them. Because in our budgetary allocation, we have an allocation that we allocate for indigents. And I think these are the largest population that will come to you seeking for your assistance. So as soon as that letter comes, I'll be able to forward to and we have asked them to forward to the clerk so that all members can be informed and you can be able to inform your constituents. With those few remarks, Honorable Speaker, thank you for allowing me to contribute.
The Honorable Dr. James Nyikal.
Well, okay, let me use. Thank you, Mr. Speaker. Mr. Speaker, we have a problem. And the basic problem is a problem of transition. So when we actually passed these bills, you remember our greatest argument was actually on the issue of transition. So what has happened and why Shah and Shif actually have gotten into problems is the transition, we didn't manage it well. And even when we said Shah, the authority which has got 3 funds. The Social Health Insurance Fund, Shif itself, is okay in bit because of the people who are employed and therefore easy to catch. What about people who are self-employed? What about the indigents? What are we able to do to them now? And that is where the problem is, because they can register. And even when they register, then you have to determine the premium they have to pay. As it is now, that is not working well. You will say I'm registered, but how much premium am I supposed to pay? It does not come quickly. And then even when you get the premium, the existing ERP that is supposed to help you how to pay is also a problem, which has been a problem even for employed people, but that is now improving. So those are the problems. So now, those who are self-employed, we are saying we are going to use means testing. They test themselves. Now, when people give this data of their employment and you say, okay, you are supposed to pay this much, how do you verify that? And are they able to pay now? And what is the system of payment? That actually is still a problem. When we talk of the indigents are people who cannot pay. And let me say this, you cannot do proxy means testing online. All over the world, nobody has ever done proxy means testing online. Because what is used, the proxies that are used themselves cannot tell you the proper means. It is always at one point you have to get to the ground and see the family. You cannot say this is a stone house and it tells you the income of the family. You have to go and see what form of stone now. You cannot say this is a mabati and not a thatch. It is maybe some tin shack mabati. So you have to do that. We have a problem there. It is exactly the same problem we have with university funding. So we really have to go for proxy means testing and do it the way it should be done. We can use the community health promoters, but so far, and even the chiefs and the assistant chief, but so far, at least in my constituency, I've not really seen this thing working. So that is exactly where the problem is. And even these who are to assess themselves. So now, what has happened, because we have gone up in the payment, those employees who are paying a lot more now are actually covering up. What about those who are self-employed and have not enrolled, and you have not know how much they enroll? And now I know when we tested this way in Eldoret, they actually, you can get and say it is registered. You are registered, you have not paid, but because you are in a hurry, we are saying you can go and get the service. Now, if you are getting the service, you have been registered, but you haven't paid. What is going to encourage you to pay? So we have problems, and the system we have put in place, it affects everything from registration, premium determination, payment of premium, benefit package. Even the benefit package, we went up because we were expecting more money. And in the primary care fund, the emergency fund, we actually were expecting 70 billion, say 75. We have done 4 and 2, as my colleague is saying. But you know, the services, the benefit package we gave was based on that. So if that has not come, and we are giving the services, where is the money coming from? If we don't do it, and it is working efficiently, what is going to happen is very soon we are going to run short of money, because we have not got that fund in, we have not enrolled people who are self-employed. We have not even identified the indigents. But because we want things to look good, we have now said you are registered, we are giving the service. Where is the money?
The Honorable, the majority leader, because of President.
Thank you, Honorable Speaker. Honorable Speaker, let me first take this opportunity to thank the Honorable Dr. Lilian Gogo for this adjournment motion, because it gives us the opportunity to address a very topical issue in our country. Honorable Speaker, maybe allow me to start with a bit of statistics that I have just gathered, Honorable Speaker, that so far, a total of 14.4 million Kenyans have registered to join the Social Health Authority program under the Social Health Insurance Fund. Out of this, today alone, I've just confirmed from the CEO of Shif that 104,000 Kenyans have registered today. And allow me, Honorable Speaker, to plead with us as members of Parliament and as the people's representatives to be at the forefront in encouraging, promoting the registration of members of the public into the Social Health Insurance Fund. It might be politically expedient and very politically correct to speak to the gallery of how things are not working, but as we speak to Kenyans on how things are not working, let us remember that Kenyans have charged us with the responsibility to make sure that things do work for them. It therefore doesn't help me. Remember St. Peter's health facility there that mushroomed into a big health institution largely from money stolen from NHIF. You remember the other small dispensaries you saw in Tharaka Nithi, in Meru, in Nakuru, and people are hemorrhaging resources from NHIF, Honorable Speaker. It is these hemorrhage resources from NHIF today, Honorable Speaker, that largely are fueling the propaganda you see being peddled against the Social Health Insurance Fund, Honorable Speaker. Today, Honorable Speaker, out of the 14.4 million Kenyans who have registered, 710,000 have done the mean testing score. And out of these people, Honorable Speaker, when you register, Honorable Speaker, and these are the things we need to be telling to members of the public, the moment you register today are telling us that the mean premium that Kenyans who have done the mean testing score of these 710,000 is 525 shillings. Because it is politically expedient and politically correct, Honorable Speaker, for me as a business person who is well-meaning, who is doing well, to do the mean testing score, and I'm told the premiums you should pay from your level of income, and also people to know that it is based on how you answer the questions that are on that mean testing score. If you own a car that you are paying insurance of 200,000 shillings, for heaven's sake, if you can insure an automobile, you can also insure your own body, your own health. And therefore, Honorable Speaker, you find people who are quoting very huge figures. But because of the answers they gave as they did the mean testing score, fact, Honorable Speaker, and these are statistics that you can examine and see and authenticate from the SHA website, Honorable Speaker. The mean premium out of the 710,000 people who have registered is 525. Out of the service providers, Honorable Speaker, 7,802 hospitals have signed up for this program. Honorable Speaker, there are a further 8,118 healthcare providers who have successfully registered to offer services, and out of this, Honorable Speaker, 7,965 have offered services under Shif to Kenyans. Therefore, for us to stand here, Honorable Speaker, in this house and elsewhere, in funerals and everywhere, to say, oh, it is not working, we are lying to Kenyans, Honorable Speaker. We should be telling Kenyans the truth. We should be educating Kenyans. And I know we may have failed in our communication strategy. We may have failed in how well we communicate and educate our people. But, Honorable Speaker, let us use this opportunity on this floor this evening to educate our people and let them know. Honorable Speaker, it is not fair that my constituents, who some are people who are unemployed, who are paying an average of 500 shillings at a time with my huge salary, Honorable Speaker, besides my business income, Honorable Speaker, and that salary is paid for by the same constituents that I was paying 1,700 shillings a month. And now because I'm being asked to pay 27,000 or 20,000 shillings a month, I start complaining and cry more than bereaved. But I'm not being honest with Kenyans. To tell Kenyans, I am crying more than the bereaved because I am more bereaved because I am paying 20 times more than what I was paying from money that is paid to me by Kenyans. That is the kind of honesty, Honorable Speaker, I want to beg that we exercise as we debate, Honorable Speaker, as we educate. Let us be at the forefront of offering civic education to our people. Because, Honorable Speaker, you have seen cases of cancer patients. You've seen renal care patients, those who are undergoing dialysis, and yet I had paid for all my NHIF. If you are unemployed, the moment you sign up, automatically you can access a level 1, a level 2, a level 3 hospital without payment. The capitation that is going to the hospitals, the facility improvement fund. You know, I was so embarrassed, Honorable Speaker, over the weekend when I had a member of parliament pretend in Kikuyu that this Shif or Shifo, and saying it is not this Shifo. Shifo is a name for a chief. A member of parliament saying that they do not know the difference between Shif and Shifo. Yet, you are seated in this house, you legislated, right from the first reading to the third reading to the committee of the whole house, you are here shouting aye, as the speaker said, the ayes have it. Then you go to your village to tell Kenyans that you do not know the difference between Shif and Shifo. That you do not know the difference between Shah and Shif. Honorable Speaker, I am saying I was so embarrassed because I would expect a leader elected by the people believing that that leader knows more than them, to be using that opportunity, Honorable Speaker, to educate their people, to tell them that if you have need to access renal care and dialysis at your dispensary or at your local level 4 hospital, all you need to do if you are unemployed is to do the mean testing score. You are advised how much premium you should pay. when you pay, Honorable Speaker, and I know these are the cries that Kenyans have raised, that the mean testing score is asking you to pay for the annual premiums for the whole year. That was the case under NHIF. You could not access renal care, cancer treatment, without paying your annual premiums, Honorable Speaker. And Kenyans were paying. Today, Honorable Speaker, because SHA, or the Social Health Authority, is yet to activate the insurance premium financing, they have now opened it up to Kenyans to be able to pay every month. Let us educate our people that you now can pay monthly premiums, access your dialysis, access your cancer treatment. Let Kenyans know that today under Shif or under the Social Health Insurance Fund, they can access dialysis, they can access chemotherapy, radiotherapy, free of charge if they are registered with this authority, if they have paid their premiums. Doesn't matter whether it's annual premiums. If you have access to insurance premium financing to pay your annual premiums, pay. If you cannot, discuss with them and pay your monthly premiums. Access those services. Honorable Speaker, my last point. Our county governments and our county governors, and I really want to plead with our county governors.
A minute only.
In a minute, Honorable Speaker, if our CEC's healthcare in our counties can take up the challenge, because other than the Kenyan public who are the major beneficiaries of this shift, Honorable Speaker, is our county governments. The Facility Improvement Fund that we legislated in this House, I know many politicians will not tell Kenyans that truth, that facility improvement facility empowers your local dispensary to have a committee that will even procure equipment and medicine at that local level. It is the number of people who are registered in that locality and who are registered to that facility that will enable the facility in your locality to access the Facility Improvement Fund that will ensure that a hospital in Gatuna in Kikuyu, the far-flung corner of my constituency, the most remote part of my constituency, if they have a dispensary, Honorable Speaker, they will be able to access the Facility Improvement Fund, be able to equip their dispensary, have medicine available at the dispensary, have money to hire doctors, and we legislated. We made it possible in this House, Honorable Speaker.
Thank you, Majority Leader. The Minority Leader will take precedence over you, Honorable Andrew Kwome. The Minority Leader will take precedence over you, the Minority Whip, for the avoidance. The Minority Whip.
Thank you, Mr. Speaker. And I want to thank Honorable Lilian Gogo.
Honorable Millie will always speak before you whenever she wants.
Though that is discriminatory because the tallest man should be speaking before. But Mr. Speaker, having said that, I want to thank Honorable Lilian Gogo Honorable Dr. Lilian Gogo for bringing this before the House. And Mr. Speaker, I just want to say that under Article 43 of our Constitution, it provides for the right to health to the highest attainable standard of health care, including reproductive health care. And legal framework, a new legal framework that replaces NHIF, and we passed 4 bills. And Mr. Speaker, I was in the House when those bills were being passed. I was especially opposed to certain parts of that bill, but that is now water under the bridge. We have a new legal framework. Mr. Speaker, having listened even to the members, the honorable members as they move, Honorable Kimani Chungwa and even the Honorable Nyikala and the Chair of Health Committee, one of the things that I can indeed say is that the proof of the pudding is in the eating. So it is actually too early to even say, we would be cheating ourselves to say that here are the benefits. We don't know the benefit yet. If you are an excellent person at monitoring and evaluation, you cannot say within a month that we can see the benefits. So yes, we will probably see the benefits much later. However, we can see photos of people who are in hospitals, who are struggling to access health care. Those with renal issues, those who are cancer patients. And Mr. Speaker, even though I know Honorable Ichungwa is actually castigating a lot of the members who he says are pushing propaganda, he's saying one. I don't know who that is since I'm not too sure. But I'm not very keen on the politics of the mountain. But Mr. Speaker, what I want to say is that we need to acknowledge that there are very serious transition issues over this. Over this. And Mr. Speaker, if we lose a life, we can never regain it. I have a person who is very close to me who is undergoing cancer treatment right now and will not receive any treatment unless there's pre-authorization of payment. And Mr. Speaker, if me, I'm at the place where I am, maybe because they are able to do that, because we, for different factors we can. But the cries we are getting from our own constituencies, the cries we are getting from ordinary Kenyans is telling you that there's a huge problem with the transition. And this transition was not done efficiently. What I would want to encourage the chairman of the Committee of Health is, one, please do a kamkunji for members of parliament. I am a lawyer and I was here when this was passed. And a lot of us would want to sit here and pretend that we understand and know. Me, there are a lot of things I don't understand about this, and I passed this law here. What about ordinary Kenyans? Do an urgent kamkunji for members of parliament so they understand what this new system is all about. Number two, we need to actually stop most of the things we are doing in this country so that members of the public understand and know how they can access healthcare. Because healthcare should be the most primary, right for everybody. Because if I'm already dead, how are you helping me? How will it be of benefit to me if I'm already dead? Even if you are to compensate, I will already be dead. So really, I think we need to take this issue more seriously than we are. Let us listen to the cries of Kenyans. If the health system is not working, a lot of the poor people can't access healthcare system, there is a problem. And Honorable Majority Leader, please listen. Please, the transition is not working well. Please take this and inform whoever needs to be informed that they need to take urgent action. The transition is not working well. Thank you, Lillian, for bringing this.
I would request we speak for not more than 3 minutes so that as many of us as possible contribute. The Honorable Omboko Milemba. I have not recognized you.
Thank you, Honorable Speaker. The issue concerning the new model of health provision in this country requires a consortium of all of us to deal with. It doesn't require even people to take podiums on one side and say that this is succeeding, while another team sits on the other side to say it's succeeding, because that will not help us. Another thing I want to say about this is that it doesn't even require statistics, quick statistics of we have treated several number of people, we have done this dialysis. I'm seated very close to the chairman, and he gave a number of such statistics, but even the leader of majority went ahead to give a lot of statistics. I was in a meeting over the weekend where the Minister for Health was called upon to speak on this. Honorable Speaker, she went straight into statistics the way I've seen this happen here, and she lost it. But later on, another speaker came, took her time or his time and spoke about slowly. I was with the Honorable Maungu, and the second speaker really scored. So I really want to remove the first thing amongst members of parliament. There are those who are supporting, those who are not supporting, those who know, those who don't know. We don't know this thing properly. And we need to know it. If we don't know it properly, the local man will not know this thing. And therefore, because I know I have 3 minutes only, the first advisor is to go with Millie. Let's have a kamkunji. But I had another one, that we need to invite the Minister of Health in this particular assembly so that he may explain to us what is happening outside there. Because unless the explanation comes out, it will be difficult. Honorable Speaker, the other challenge is the ownership of the whole setup. The Kenyans are not willing to own up this particular new model of funding. And the ownership can only be developed if, as the members of parliament will go outside there and explain. And also involve other parties. The chair here talked about is having people within this, and I've asked him informally here, that there are people around who can actually do the mean testing and actually register people. I'm telling you, Honorable Chair, that there are no people registering people in this scheme where I come from. And I have decided, since Sunday, I decided that I'm going to help. So for me, I'm going to go out flat to register all my constituents. But we have to involve other players. Let's not say that we have enough staff. Those CHPs, if they were trained to actually register people in this scheme, it would work. After all, they know everybody. They know the indigent. So even as we do the mean testing, they can actually add up to bring out the whole thing to work properly. And I think that's the direction we need to take with this thing. Otherwise, once the Kenyan person is complaining, we are not safe, even if we give whatever number of statistics. So for me, we need to own up this model, go and explain it, and use every other people within the circles to see how the model can work. Thank you, Honorable Speaker.
Honorable Karoli Modi.
Thank you very much, Honorable Speaker, for the opportunity, and thanks, Honorable Lilian Gogo, for bringing this matter to the floor of the House. I agree with the other speakers that the transition has been very bad in this particular matter. I mean, there are already patients with chronic illnesses who are already being served under NHIF. And I wonder why they just never made the full smooth transition into SHA. Because they were already covered, they were already paying their premium, they were already receiving the services. But today they are being asked to register again. And I think this is where the biggest problem is. So we would like to hear from those responsible why there was no bulk transmission of existing members under the previous insurance scheme who had current premiums. And to make matters worse, even those who are enrolling today, they're having difficulties making the payments under the system. It is quite a challenge. You go to hospital, you enroll, you try to pay, you don't go through. But, Honorable Chair, I think the most critical thing is that this new scheme is grossly underfunded, and it will not work unless the issue of funding is addressed. The data I have, and Omboko Mulema, please forgive me for using some numbers, NHIF legacy debt is over 30 billion, which is not paid to service providers. How will you convince them to start accepting new patients under the new system, especially the private sector hospitals? The actuarial projections were that about 50 billion would be needed to start underwriting the 3 funds that we have created. Only 6 billion has been made available of the 50 billion that was required. And as the majority leader said, 14 million members have registered, but only 700,000 have paid. And I suspect these 700,000 are those who have been captured because of employment, not because of being self-employed. Yeah, because they are employed. So basically, we are looking at a new system that is grossly underfunded, projected to cost about 275 billion in the long run to make it fully functional, but is funded at 6 billion. And to make matters worse, we have committed 105 billion to buy a health management software system, information system, 105 billion, instead of committing the money to underfunding the insurance schemes under this scheme. So I think the biggest problem is the way this thing is being funded. And without sufficient funds, I can guarantee you it will fail. It will not work. Thank you, Honorable Speaker. I think we should have the Kamkunji so that we all get educated on this matter better. Thank you.
The Honorable Gadoni wa Muchomba.
Thank you, Mr. Speaker. I rise to thank my sister, the Honorable Dr. Lilian Gogo, for bringing this motion. I indeed had tried to bring the motion this morning, and I wrote to the Speaker, but I was informed that she had done that before me, so she was given the precedence, and I appreciate. Mr. Speaker, I personally went to various hospitals after I got a lot of calls from my voters on matters to do with the denial to access to health. I went to 2 hospitals that are mission run, 1 public referral hospital and 1 level 2 hospital. And I interacted with the patients, and I gathered there is a big problem. Whereas we sat here, like majority leader says, and we passed these laws, personally I did not pass them because I had issues with one of them. We must appreciate that you don't bring a new law and rush to implement the law without involving the stakeholders. When I went to those hospitals, Mr. Speaker, one of the hospitals told me and confessed to me that they are owed over 200 million by the former NHIF. And therefore they have a problem. I mean, how do you tell me to continue treating patients under a new program and you've not sorted my previous debts? And I know this is the problem. Most hospitals, by the way, the ones that are rejecting patients, they are rejecting patients because they feel that honestly, somebody needed to come out very clearly and tell them, we are migrating. But are we migrating with your debts? Are we migrating with your problems that we have not sorted under former NHIF? So this is the problem, Mr. Speaker. And let us not come here and read numbers. I appreciate the numbers that have been read out here by Majority Leader, numbers read out by our Health Chair Committee, Dr. Robert Pukose. But numbers is not what our people are waiting for. From this debate, they're waiting to hear how are they going to be treated tomorrow in hospitals, Mr. Speaker. Mr. Speaker, when I went to one of the hospitals, I found a patient who was withdrawn from the ward, only to go and queue out for dialysis at 6 a.m. from the ward. And I visited that hospital at 4 p.m. here in Nairobi. And I found that patient in the queues waiting. And he told me the reason why he has been waiting from 6 a.m. to 4 p.m. in the day. It is because, Mr. Speaker, the messages that were supposed to be sent from SHA so that he can be embodied for services were not being accepted. We must tell it as it is. This new program is a total confusion, it's a total mess. Our people don't know what to do, and we must go back to the drawing board. But for now, let us withdraw these processes and go back to the original program until we are right. That SHA, she, da,
Honorable Sabina Chege. Because of the limited debate time, let us avoid points of order so that we tell Kenyans what to do.
Thank you, Chair, and I want to thank Honorable Lilian Gogo for this motion. And I would say she has been consistent on this matter. I've seen her raise it before. Mr. Speaker, the problem we have with the implementation of SHA and SHE is about the clarity of the transition. Mr. Speaker, when the government decided to move from NHIF and now to the SHA, which is the authority, and with the benefits that we are being given by the chair from SHE to the emergency to the primary care, there was no proper communication and clarity on the benefits. As a former chair, Mr. Speaker, yes, NHIF had many challenges, but when patients visited hospitals, they knew what to expect. So a patient who was to go for dialysis, a patient who was to go for chemo, and who are majority of Kenyans, Mr. Speaker, they knew when they went to hospital what they were to pay and if they were to top up. Unfortunately, Mr. Speaker, when the 1st October came, I also became a victim. I had a patient in hospital, and even with an insurance, Mr. Speaker, it was very difficult to claim what was meant to be NHIF, which now had become SHE under the SHA authority. And so, Mr. Speaker, I would urge the chair of the Health Committee, peace members, and I know even yourself interact with your constituents. It is the high time whether we can even be able to do a public participation.
The Social Health Authority was well intended to ensure that every Kenyan gets access to good health care. But I want to agree with my colleagues that there are challenges in transition. Just like any other program or project, there will be those teething problems when it's being implemented. And I think that is where we should focus. But there are also success stories. Honorable Speaker, I'm just from my constituency. The whole week, I was not in Parliament last week. And I did public participation. And one of the issues I was sensitizing my people on was on SHA. And they said, Mweshima, we did not know. And the information the chair was telling us, we needed to sensitize and educate Kenyans so that they know what is SHA, what is the premium, how do they benefit, how do they pay. That information is lacking. And while we were doing public participation, one of my constituents, when returning back home, broke his hand. And we rushed him to hospital, to one of the private hospitals in town, and we were told we needed to deposit 100,000 cash money, which we did not have. I demanded that the patient is transferred to Bungoma, where we looked for a hospital. We were being told 70,000 we did not have. But before we went to Bungoma, I made sure the patient was registered with SHA. So we managed to get a hospital in Bungoma Hospital that accepted to admit this patient from Busia County, Teso South, and he was treated with SHA, and I only paid 25,000. And as I'm talking to you, he was discharged yesterday. So the problem is lack of information. The problem is equipping our hospitals properly. And Honorable Speaker, the Chair of Health, I want you to listen to me. We must put a proper budget to health so that we are not depending on donor funding. Diseases like cancer, in the last budget, we only gave them 250,000 for both recurrent and for them to establish cancer centers across the country. What can 50 million do? 200 million was for recurrent. So we need to equip. You go to Busia National Hospital, you find 3 mothers from the maternity sleeping on one bed. We must improve the facilities even as we work on improving the transition to SHA. The problem is in our facilities, equipments, and we need more doctors in our hospitals, Honorable Speaker. Thank you.
The Honorable Sarah Korere.
Thank you, Speaker. And Speaker, I want to thank my sister, Honorable Lilian Gogo, for bringing this adjournment motion. Honorable Speaker, as other speakers have said, she or Shah was well-intentioned. But Speaker, the trust deficit that it has brought about, the lack of stakeholder engagement is wanting, Mr. Speaker. And I say so because in every county, in every constituency, we have government officers up to the level of assistant chief. So, Speaker, if all the administrators who are called and educated about this insurance fund and given the requisite information, these people are paid by government, the assistant chief, the ACCs, the DCCs. We cannot, depend on politicians who will politicize everything and want to seize the moment, even on things you had passed on this house, just to paint how bad some things are, because they think they are on the other side of the division. And Mr. Speaker, as I stand here, my pay slip has been cut, and so are other civil servants. We feel the pain on the cut, but Mr. Speaker, will really enjoy when our people get services. Every member here, I'm sure every weekend, you are being called for some arambe, even when they know they banned arambes. You are being asked to contribute for some sick person. It is humanitarian. You can't start telling them arambes were banned. And Mr. Speaker, health is not a privilege to Kenyans. It is a basic human right. It should not be a luxury. We don't have the option of deciding whether Kenyans should have a proper health coverage. They must. It is a must, Mr. Speaker. So what am I saying? This thing requires a proper stakeholder engagement. We create proper awareness. The trust deficit, we should be honest to ourselves as leaders. For a very long time in this country, health has been a privilege of the rich. And I think that is what the president is trying to change. It should not be a privilege of the rich. It should be a right of every Kenyan. And Mr. Speaker, we know a healthy nation is a wealthy nation. If our people are healthy, they'll go about their businesses. They will contribute to the economy of this country. So, Speaker, it is not whether we are going to provide them with it. We must. And as a house, we must take responsibility. Those people, NHIF was marred by a lot of corruption. Even as we...
The Honorable Beatrice Elachi.
Thank you, Mr. Speaker.
I'm going to take a lot of time this side.
Thank you, Mr. Speaker. Mr. Speaker, I also rise to thank our sister, Dr. Lilian, but more importantly, for just giving me the opportunity, because last week I walked into the Committee of Health to get to understand. And Mr. Speaker, this health cover is the best for Kenyans, yes. But what we need to understand, and what the committee and our chair of health needs to understand, you cannot have a system where you appreciate the hardware, but you forget software is what will make the hardware work. And that is the crisis we are in, Mr. Speaker. one of the things I need them to come and explain to us, in all insurances, there is a cap. You know, in Shif, you don't have a cap. So if someone is paying based on your salary, you are just paying. And those are some of the things Kenyans are feeling. They need more explanation. There must be a cap on this. Mr. Speaker, the other thing is that it is time for all of us members of parliament to put a desk in our constituencies. Let us register our people through our community health workers so that we see these numbers, so that we now get to understand, and even as ourselves, to have a tent here outside here in our own bunge, for us also to know whether you have registered, yes. But if I go on my phone, it does not show me that this month I was able to contribute the money. So how will I know that I'm contributing? So it needs that system analysis is where there is a big problem. And Mr. Speaker, there is worse problem in the digital one, where we have all these multi-agencies that have brought us into this crisis. Yet we bought a machine for nearly 1 or 4 billion. We should not be in this crisis. We should be now having a health cover, and we should be now celebrating that we have a health cover for everyone, but not going into the crisis we are going in. And then we find putting our president into a lot of challenges because of what we have done. And yet it is just in the Ministry of Health where we have that confusion, Speaker. And this is the time that they must come here through a Kamkunji, realign everything, tell us how the claims management system works, tell us very well how the counties are going to, they are benefiting, yes, but then how do people register for their county hospitals to benefit is very critical. Therefore, thank you, Daktari, but we need a Kamkunji very fast.
The Honorable Guyo Jaldes.
Thank you, Mr. Speaker. I think what we need to know, the concept of universal health care is the best thing for this country, where anybody can walk into any health facility and get appropriate quality treatment is what we all need. And that is what SHA is expected to address. The problems we have today on SHA, and I'm sorry, the majority leader was teasing people. They do not know the SHA, the Shif, and the rest. And he's the one who's telling them, waving to them, say yes, say yes. And they are saying yes because they were obeying his orders. And today, he is telling them that they do not know what they voted for. I wish he was here to accept, to hear this.
Honorable Guyo Jaldesa, so many of us have just agreed we don't understand the systems.
Thank you, Mr. Speaker.
In fact, that is why I'm giving more members of the Health Committee a chance to speak to the public and to fellow members.
Yes. So, Mr. Speaker, Ruku is thinking about what to say. But, Mr. Speaker, this is a good thing. This House approved that motion. It approved through all the 3 readings. And it's unfortunate that our members of parliament do not understand what they passed. And for that, I think we agree that we need to have a Kamkunji for members of parliament so that when they go out to the public, they know what to tell the people of Kenya. We know there are teething problems. Any problem, any project that you are starting as a teaching transitional problem, that it should be sorted out. So last week when we met the SHA team, we said that even Parliament, they should even open a tent here for them to register members of Parliament and their staff so that they understand these things and ask more, and then they go out to the public and tell them what to do. Final, because I can see the thing is changing. The counties have collapsed and it's giving us problems. But my appeal, do not close any of the former NHIF branches and do not lay off the staff of NHIF who have been working for NHIF just because we have changed from NHIF to SHA. Thank you, Mr. Speaker.
The Honorable Gideon Ochanda.
Thank you, Mr. Speaker. Mr. Speaker, the juggernaut that is in front of the nation is basically a combination of factors, but the very basic one is poor learning experiences. We've learned this many times before, you've seen this many failures before, but it's like we didn't learn. So because of that, we have not connected those learning experiences to how to communicate with the public and how to manage transition. So this is basically the main problem that we have as a nation. All these registration processes have failed before. In the last parliament, we placed 6 billion each year for 3 years for purpose of registering indigents. Nothing came out of it. We've seen in the past registration even of basic things like the huduma number. It failed the nation. So anytime that we are talking about registration of any manner, we must learn from that the past experience to package how we communicate with the public. And that's where the biggest problem is. Because I was talking about is fantastic, but the public don't have it. Who is it that is supposed to be communicating with the public? I don't think it is the member of parliament who is supposed to be communicating the official communication of the government to the public. They can only help, but there's a basic office, there must be a basic segment, there must be a basic department of government that communicates with the public officially about government things. And that's exactly why we have not, the way we have managed, for example, ID, we initially had that big thing. It remains, it works. Then we change to the small ones. So the old one works through for a long period of time. Why don't we have even those registration of NHIF and the rest that we had before? Work through to the entire period so that we don't put a stop or an end to an exercise that we know must run on for a long period of time. Even the registration process, even the start date of SHA has failed to pick up in the last 2 years. So those kind of things makes the public not to trust, not to get the information the way they want, so that believing becomes a problem. We must reorganize how we communicate for us to deal with the public. Thank you, Mr. Speaker.
Honorable Dr. Makali Mulu.
Yeah, thank you very much, Honorable Speaker. Honorable Speaker, I just want to join colleagues in appreciating this motion. And I want to say this, Honorable Speaker. I want to go on record that I participated in passing this law, the 3 pieces of law. There are things we objected to. We said they don't make sense, but as usual, our voices were buried. Now, one of them, which is critical, Honorable Speaker, is when you're introducing a new program, if you are programmatic in terms of thinking, there is always what we call the piloting phase, so that you pilot, and as a result of the lessons learned from piloting, then you roll out to the whole country. And I think that's what Dr. Ochanda is saying, that the interface, we missed it. That's why we are facing so many challenges in terms of the transitional phase of it. The second matter, which is critical, Honorable Speaker, you remember the issue of the staff was very, very hot in this, a very hot debate in this House. And we said it's important, we assure the staff, the NHIF staff, that they will be taken care of in terms of transition. Now, we have an authority here which has come on board. They are using a very demotivated staff because they have not come out clear what is the fate of the NHIF staff. As a result of that, they expect them to work as if they are very happy. And these are some of the things you don't get right and you fail. The third point, Honorable Speaker, the issue of the budget. The allocation has been less than a quarter of what is expected. But to make things worse, we come here and publicly announce that we have a digital system which we are going to install, which is going to cost 104 billion. You are telling us you have no budget to roll out the program, and you are buying a digital system at 104 billion. These are the issues, Speaker. So, Speaker, we are saying the government should be able to listen, so that when Kenyans are saying this thing is not working, can we allow Kenyans time? We say let's allow another 4 months so that we have that interface, NHIF and SHA. And if we do that, Honorable Speaker, you find within 5 months, we'll actually phase out NHIF and have Shif coming on board, but in a very smooth way without really disturbing the process as it is now. Thank you, Honorable Speaker.
The Honorable Irene Mayaka will be followed by the Honorable Andrew Okwome Adepu.
Thank you, Honorable Speaker. And Honorable Speaker, I just want to express the sentiments of majority of members here that this one of the biggest gaps in SHA and Shif is the lack of communication, either to the public, to us, the members who represent the public. Nobody really knows what is going on. And that's the biggest issue that we really need to take care of. Honorable Speaker, for example, the staff who are working under majority of them communicated to them in terms of what is going to happen to them. And this communication needs to be very clear. Honorable Speaker, I hear a lot of members suggesting that we should have a kamkunji. I actually think that we should have the CS come here during a session so that we ask proper questions where the public can see exactly what is going on. The other thing, Honorable Speaker, is this is an IT-based technological system. And one of the things that we know in the IT space is that when you are moving to a different technology, you have to do what is called a grandfather piloting. What this means is that you pilot in batches. You try one place, if it works, if it doesn't work, you get the feedback, you rectify that, you grandfather that system, and then you move on to the next batch. But this was done en masse, which is very scary and very, very dangerous. And a lot of patients have suffered as a result of this. So what I want to urge the chair and the CS, and I hope he's listening, is that can you now start a process of communication? We have access to social media, we have local media, we have vernacular media. Why don't you use all this that you have access to educate Kenyans properly, to understand this, and also take on the feedback that you're receiving from Kenyans, so that so that you're able to know what the issues are. Otherwise, there will be no acceptance of SHA and Shif as an alternative to NHIF. Right now, everyone believes NHIF is what works. So it's up to us. We have the responsibility of ensuring the public understand why this is a better alternative. As at now, we all don't think it's a better alternative. I thank you.
The Honorable Andrew Kome.
Thank you, Mr. Speaker. In fact, I'm surprised that some of us do deny that people are suffering out there. I'm telling you, the situation out there is very serious, and because of that, I'm happy my colleague, Honorable Gogo, brought up this issue. One thing that I see is the cause of this problem is changing of names from NHIF to Shif. Perhaps the system should have worked in such a manner that the two systems were to run concurrently as NHIF gives way to Shif. But if you make it one day, a number of people were caught up. They were neither in NHIF where they were deregistered, nor are they in the new system of Shif. So when illness comes, when a disease comes, they are just, their fate is death. This we must accept, because if somebody is nowhere, then it's not registered. And with that situation, I would say that the government must take this thing very seriously, because even as I speak, there are many people who are not registered anywhere. I think this we need to do something on very, very urgently. And in addition to that, a bad mistake was done that there was no public participation adequate. There was none. So people know what's going on. That's why you hear Shif, Shaf, his, whatever. This is because of not knowing what is going on. So, Mr. Speaker, sir, let me say we need to reverse the situation in a way that everybody can be given a chance to live.
Honorable Andrew Kome, your time is up. The Honorable Wilberforce Oundo, in 2 minutes.
Chair, I have been on top of the log for long, but it's okay. Honorable Speaker, I think there are two issues here that the committee and the executive needs to address. One, majority of the hospitals have got legacy debts from NHIF, and probably there isn't sufficient legal mechanisms to transfer the liabilities of NHIF to SHA. So you find that many hospitals, therefore, are no longer are not happy, are not willing to take up more responsibility and more debts. So it's therefore important the executive needs to assure service providers that whatever you are owed by NHIF will still be taken over by SHA after the due diligence process is completed. Second, Honorable Speaker, yes, we might have insurance cover, but if the primary facilities do not have adequate resources, then the entire system, Honorable Speaker, is going to collapse. So for that, because we are running short of time, it's a good idea. Let the executive work on it so that we resolve these issues. Thank you, Honorable Speaker.
Lastly, the Honorable Eric Muchangi.
Thank you, Honorable Speaker, for this opportunity. I wish to thank the Honorable Dr. Lilian Gogo for this very important matter. Honorable Speaker, I wish to agree with the Honorable members that say that we need to do more sensitization and information sharing about Shif. Because, Honorable Speaker, I have done my own research within my constituency, and I have seen that we have some considerable number of people who are uptaking this Shif, but there are challenges that have come with this new program. And I am thinking that sometimes we have a very ambitious program of planting trees in this country until everyone gets into the program of planting trees. And on this issue, important issue to do with healthcare, I believe that we should, as a government and as leaders, invest more time in educating our people, because we need more of them to get enlisted in this program, and we should not fear that this program is new. You know, in this country, we have a tendency of rejecting almost everything. This idea of having a new...
that was made to be paid for those hospitals that were not paid their NHIF. What happened to the money? They should be paid. How can I give you service if you have not paid me what you owed me previously? Mr. Speaker, we need to look at it again. We are not saying that it has failed, but we need to review and see what can be done to give Kenyans the universal health coverage that was promised. Thank you very much.
Order, honorable members. Honorable members, the interest on matters health and education is big. I thank you for the interest shown. I believe we can have this through other forms and procedures within the assembly, so that the matter health, including the thoughts around Kamkunji and those other processes that can make us stabilize the thing. I'm very happy that we are thinking of solutions, not lamentations, because indeed it is this parliament which killed NHIF by repealing the act and established Shif by enacting the new laws. Honorable members, the time being 7:09 p.m. This House stands adjourned until Wednesday, the 13th day of November 2024 at 9:30 a.m.